thank you for coming. Thank you especially to Sian for coming and being our guest tonight. Tonight's topic is healthy, sustainable and inclusive food systems. So agriculture is a main source of income for several 100 million people, which we all know, around the world, especially for those who struggle with poverty and hunger, most of whom are connected to small scale or smallholder farms, which collectively supply most of the food for developing communities. So agriculture is one of the most powerful tools to address and end extreme poverty, especially for those most vulnerable in the communities, and we often know that they are women and children. And the focus is on rural communities when you talk about those things. So where there is a need to transform them to provide a reduction in inequalities, when you need to look at those food systems. Yeah, we're still here. So, and surprisingly, well, maybe not so surprisingly, so growth in the agriculture sector is 2 to 4 times more effective in raising incomes amongst those poor communities and the poorest of communities compared to other sectors, and is therefore crucial to economic growth, aside from the primary outcome of providing food for those communities. So when we're talking sustainable food systems, those systems must have support. So we need not only economic sustainability, we need to look at social sustainability and, of course, environmental sustainability. So, on to our guest tonight. Sian Huang, did I say that right? Yep.
Yeah, very good.
Thank you.
Honorary Chinese person.
Pretty good with languages, Chinese. So, Sian Huang is a global health specialist and a public health practitioner specialising in maternal and child health and nutrition. Before joining, she comes to us from the Burnett Institute. Before joining the Burnett Institute, Sian worked and lived overseas, mainly in the Asia Pacific region, which, well, I don't know about everyone else, but we know fairly well. I certainly know I know fairly well, including Nepal, Thailand, Cambodia, Laos and PNG, working for various international NGOs and UN agencies. Main focus of your work has been program management, planning, implementation and research. And as a result of your experience in international development, you're now, I'm impressed to say, undertaking a PhD. Is that right? At Monash University?
So, yes. Such is my life.
Mad woman.
Yeah, a little bit.
Investigating the use of digital technologies to improve nutrition assessment in low resource settings. That's fascinating. And as part of that, you actually piloted, or part of a team I assume, that piloted the first mobile health app on newborn health in rural Cambodia. Now, we have to explore that a bit more later, because that initiative, like I say, we'll look at that in our discussion, because that just opens up so many questions when you think about rural communities in developing countries and you're talking about digital technology. They seem very far apart. So actually trying to introduce that as a resource for them and as well as a data gathering source is fascinating.
Yep.
It's just in terms of getting new technologies out there.
Yeah.
So that's really great.
And that was a few years ago. Imagine
was
now.
it? Oh, okay. I didn't look at the date on that. Oh, wow. Okay. Well, that'll be interesting to hear what the outcomes of that have been and how successful that's been, if it, if in fact it has. All right. So some fascinating avenues for discussion there, and I might start, Sian, getting you to talk about or give us a brief insight, if you like, to start with, on your pathway to your current role with the Burnett Institute and why you were drawn to women's health and nutrition as a focus of your interest in public health.
Well, so I started off as a dietitian, so I did my bachelor's at Monash University. And it started in my year 10 careers counsellor's office. So she was like, oh, what do you want to do? And I was like, I really like food and I really like people. She goes, oh, have you heard about dietetics? And so that kind of like merged the two together. And then the Monash dietetics course was very clinical and I didn't really enjoy that. So I went on we also did a public health element, which I really enjoyed because I liked to, and probably a lot of you here, like to sort of kill many birds with one stone, if you will, and that's what public health is. You know, you're working on such big impact things that you're not just obviously there's value in client to client sort of based stuff, but I just wanted to do something that was a bit bigger, and if I was just using my time efficiently instead of affecting a few hundred at a hospital, like a few thousand or populations, you know, everywhere else. And then I don't know if it's what it's called now, but previously, and I'm saying like, I don't know, like 20 years ago, what is it, 2024? Yeah, so about 20 years ago, we had the Australian Youth Ambassadors program, which I think is like part of, I don't even know what it's called now, AVI or something like that.
Yeah, because they used to have Australian youth volunteers.
Yeah,
and they
now it's
went
just like
straight old volunteers.
All volunteers. So I went through that program when I was doing my dietetic work, and I actually started in health insurance, so nothing to do with the public sector at all. Actually, my friend and I were the first dietitians to ever work in private health insurance.
Wow.
And we worked on a disease prevention program for cardiac health. And so while I was doing that, I did my master's in public health at Monash, just do everything at Monash, one ID number to remember. And so, I did my master's while I was working, and then got into the Australian Youth Ambassadors. And that's sort of my doorstep into everything that has happened to me, you know, one of those life-changing, set your course kind of moments. And that was my first posting with UNICEF, where I worked in Nepal on a micronutrient program.
Wow.
And so when I was looking at different, you know, you apply for lots of different projects under the Australian Youth Ambassadorship program, and the only sort of nutrition related things at the time were around micronutrient deficiencies. And it was quite a new thing where they have little sachets of powder, kind of like a multivitamin pill.
Okay.
In a little sachet form, and then you mix it in with like rice porridge or whatever the local food is to give extra micronutrients into the kids, because their food diversity is not very high. So
newborns, infants, particular age?
It's for 6 months and above, because newborns and infants are meant to have breast milk exclusively. So as soon as you start feeding solids to children, that's when you can start using those micronutrient powders, and they've gone like global now, and in a lot of supplementary programs as well for feeding, like in a refugee or humanitarian context as well. So I think that's how I got into maternal and child health, because I was working on that program. That program was specifically on young children. And then I started on things related to infant and young child feeding, and so then all of my nutrition stuff kind of really flowed in with that. So I started in Nepal, and then a lot of these jobs are, because it's such a small community, it's like a lot of word of mouth jobs that go around, and someone heard something about something or other, and that got me into the Food and Agriculture Association organisation, so FAO, which is a part of the UN system. So I got a job with FAO right after Nepal in Cambodia, which is on a multi-sectoral agricultural program. So a lot of these agricultural programs only focus on the production of food, but not the use of food. So this project that I was on was funded by the EU, and it was this huge sort of global thing where they did it in, 35 different countries, and the EU gave like $1 billion, something random, really high. And I think our project was something like $14 million or something. And it was trying to develop agricultural systems in the rural communities, of which there were many rural communities in Cambodia. And they worked on irrigation, they worked on fisheries production, they worked on poultry, they worked on like all sorts of different agricultural production, smallholder farms, and bringing that to market, the value chains, everything. And then I came in to help out with the nutrition side of things, which is how do we use the food that they're producing now to improve family feeding, which often a lot of these programs miss out on because they only see that one part. But
I was going to say that it would occur to you that if they're focusing just on the production of food and agriculture, is it production for sales? Is it production for export? Is it production for local use? Is it production for self-sustainability?
So it was like a bit of everything. So it was mostly for to raise income, but saying that what you produce you can also keep, because often you just produce and you really don't keep much for yourself, and you're still kind of in poverty. You sort of hoard the money without actually using it to improve your own family status. So that project was saying, actually, you don't need to reserve too much. You know, you can still sell quite a large proportion of what you produce, but if you just reserve certain quality, you know, high micronutrient foods, or, you know, just instead of selling all the eggs, keep a couple for your own income. Because often what they do is they'll sell everything and then they'll have to go to the market and buy it again. You know, like... Yeah. So this was a way to say, you know, what are the good foods, especially for children, right, and pregnant women, lactating women. What are the really good foods that you can keep that actually you're producing or your neighbour's producing as part of this program, and how can we come together and use that food to improve the family diet, you know?
So I imagine there was a bit of a generational mindset change that had to happen in terms of certainly the small landholders and small farmers just being used to selling everything and putting themselves at the bottom of the priority list in terms of them and their families. So you had to change that mindset, saying don't forget to keep some of what you produce for yourself and your families.
Yeah, and this is how you do it.
Yeah.
So we created a bunch of resources, and like we were saying, like it wasn't so much health system strengthening, it was like family strengthening, you know, like creating a bunch of resources with the health teams, local health teams, to say, okay, this is how you make this food. So we had like big posters, and we do like huge community days, and everybody comes in, and, you know, this farmer that, you know, has a community fish pond, he brings a couple of fish from there, and this family with the poultry, she'll bring some eggs or whatever, and they all come together and they make this big batch of food, and, you know, to show this is the kind of consistency you need with this food, this is how much you need to feed your children, and this is the variety, this is what you might look like. And these demonstrations really helped, you know, I guess, bring in the whole picture of the rest of the project. And that's where I met my husband, who, you know, I probably would never have met, because he was working on the irrigation engineering part of it. So he's an engineer. So normally engineers and Dutchies don't cross paths. So that was, you
development sector's good for that.
It is,
a
lot of crossover, and you kind of want that, don't you? You want that multi-sectoral element. So I worked in Cambodia for like ages, enough to get married and have a kid. You know,
so a while. So whereabouts in Cambodia were you were like based in what, Phnom Penh or Siem Reap?
I was actually based in Siem Reap.
Okay.
Yeah, because we had, on that project, we had so many different provinces, and so a team of us covered the northern side, a team of us covered the southern side, who were based in Phnom Penh. So, and then out of that, I think I just worked on a lot of different areas of nutrition in Cambodia with lots of different organisations. And again, through someone who knew someone, we need someone to cover maternity cover, whatever. So I moved to Bangkok and worked with UNICEF at the regional office.
That would have been different.
Where it was very different. So you went from like really rural, sort of provincial level stuff, very community stuff, to like regional policy stuff. And you were like writing policies, reviewing policies, and evaluating this huge program that covered sort of 5 different countries, but in the same area around infant feeding and micronutrient supplementation, all that kind of thing. And so then moved on to Laos, where I did some research work, and then went back to Cambodia to do some consulting, and that's when I started this M Health project that you just mentioned,
the mobile app one,
So I worked with a small Czech NGO, and that program was, it was really novel at the time. You know, it was like when M Health, I think this was in like 2011 or 12 or something. So it was like a good...
That's a while ago.
Really long time ago.
Yeah.
So it was still using voice recorded messaging. It was like leaving a voicemail on someone's phone. And that was really new at the time, because people didn't know what was happening in M Health. It was sort of exploding. It was a really cool program. We worked in a small area. We sort of just piloted it just to see how it went.
Was it really hard to actually implement, in terms of the access to digital technology, even in its most basic form in
Yeah,
2011,
well,
let alone
was.
people's knowledge around how to use that.
Well, we were trying to capitalise on the fact that mobile phones were exploding in Cambodia. Every single person seemed to have one. Not a smartphone.
No, I was going to say, but did they know how to use them and what you would do?
Yeah,
The
so it
old
was like
Nokias or something,
Yeah, it was Nokias. And all it was like, you know, press 1 for this, press 2 for that. But that's all they needed.
Right.
So this project, we recorded in a sort of dramatic way.
Okay.
You know, like, you know, if you were recording a message between
Okay,
a pretend
yeah.
doctor and a pretend patient. And so it was like little voice messages of reminders, you know, oh, Dr. T said, oh, don't forget not to mess with the umbilical cord of your baby because that could cause infections, you know.
Yeah.
And that would be a message we timed in the first 7 days because that's when the umbilical cord is still there.
Yeah.
So we had these timed messages and it would sort of spam everyone in a way and they would go off and they were like, oh, I got a phone call. Oh, I'm so popular. I got a phone call. You know, it's from this program.
That is really innovative.
Yeah,
That's very,
And we actually worked
first step.
with the cell phone companies, the local companies at the time. And it was really effective. We were trying to bring down newborn mortality rates. And I think we piloted, I can't remember now, we piloted for a good few months and we did see like a reduction in newborn fatalities. You know, so
given that was the pilot program, I'm assuming it's expanded and obviously upgraded in terms of apps and stuff.
Yeah, so I have lost touch with them over time, but they did expand it later, actually into video messages as well.
Oh, okay.
That they would play, and lots of sort of other information, education, communication materials that came out of it. Lots of posters, like notebooks for health workers. Diaries for parents and things like that. So it did expand. I don't know what it's happened now, but that was sort of, I just sort of started that ball rolling. And I think it would have changed a lot now over time because now everybody has a smartphone, not just a Nokia phone, you know, although Nokia makes smartphones. But so that was like really cool and that sort of started my whole research career, I suppose, and I think I came to it in a very sort of roundabout way. You know, like people do their bachelor's and they do their honours and they do their master's, then they go and do a PhD. But I sort of like, I did a master's because I needed to do one, you know, and then now I'm doing PhD because I'm like, I found this need in the community that really needs to be addressed. Yeah. How am I going to address it properly?
Okay.
So I'm just doing a PhD to sort of address that need. Yeah. So anyway, you have children and things happen.
Yeah,
and
life happens.
Life happens and you can't live that exotic life overseas anymore, which is a shame. You eventually have to come back home and so come back home and have more children. And so I ended up at Burnett because I was covering someone else's role and they needed someone. It just happened to be a project I was working on in Laos with the same team that I had worked on previously.
Okay. That's handy.
So I like knew all the people and I was really, that was the catch. You know, oh, you already know these people, great, we don't need to orientate you. Here you go, here's the project.
Okay.
And so it's a big randomised control trial we're still doing now. That's how I ended up back here at Burnett. Yeah, which is a funny, I think a lot of people who practice in the field end up in a sort of a researchy capacity when you realise there's a need for further evidence. And so it was a natural progression that you come from being a practitioner in the real world and come back and do research.
And that will never
about
change in terms of there's always going to be a need for, you know, evidence-based data and stuff in terms of the different research that we do across the development sector.
So that was a convoluted way of getting here.
No, I was going to say that's really good because I mean that underlines the fact that, you know, experience and being in country and doing different projects, and like you say, it's the networking and it's the word by mouth, which we all constantly repeat, is the way this sector works. It really is the way this sector works. It's really not a question of going online and looking for a job and getting it in the development sector. More often than 99% of the time.
You won't get those jobs. It's more about
99% of the time
it's
literally, you know, connecting with people and
I think women do that really well. Because we like to talk, we like to chatter, and then when there's a conference, you just like meet people and you chat to people, and you know, so and you expand your network.
That's it, you know, and you know, and that's, you know, that is the way this industry or this sector works, sort of thing, and I think for the betterment of the sector, sort of thing, just because of what it brings out in people and stuff, and what you're able to do. So, in terms of the work you've been doing, and especially the work, for instance, in Cambodia and stuff, where you've been in community, where have you found the main issues of, say, food security when you're talking about agriculture and talking about small farm holders and that? When you're talking about not just the production, but the issue of food security as it relates to health, especially for women and children. But where we're looking at food security to ensure and support women and children's health and stuff. That security issue, which is, and it comes in many different forms. It could be whether the land whether it's sustainable, whether the production process is sustainable, whether the water is available depending on the climate change, whole lot of stuff, whether the soil is overused. How is that? Is it addressed in those sorts of, in the areas you've been working in and the sort of work that happens in agriculture these days?
Yeah, I think it certainly does, but I think at the end of the day, a lot of that agriculture stuff is still focused on men and what men do in that area, and I think a lot of that power still relies with men. So if you're looking at labouring and toiling, and we did a lot of mechanisation in our project to try and reduce the labour of ox carts and things, to try and introduce the machines that do the ploughing. I don't know what it's called, but stuff with the digging stuff, instead of having an ox going really slowly, it's like, have you thought about this? And we as a project would support maybe the community to come together and buy this thing or whatever. And I think anecdotally what I've seen is men tend to prioritise income for the family on production, and so they think about, how am I going to access the market? How am I going to increase the production of whatever land that I have? How am I going to diversify my crops? And women tend to not have a huge say in that. And but then women, at least from my health and nutrition sector, women control all of that decision making. But then they're not able to access the production that they have because it's reserved for the market or something. Certainly like with rice or something. So one story I heard was we were trying to improve rice yields and we were looking at different sort of types of rice, like different grains, and how resilient some rice are to the weather and climate, and then looking at how to irrigate that rice without using so much water, and rainy season, wet season, when's a good planting, and all the women help with all of those things. But the men it was about like, we'll sell this rice for this kind of price, and they would sell all of their rice. And then when it came to sort of, they would be food secure for that amount of time because they've sold all their rice and they've got the money. But they rarely ever really kept any of it for themselves. So they'll sell all their high quality rice and it would be linked up with, people in other countries like Thailand or whoever to sell on for bigger money. And then they will buy the cheap rice from the market, the stuff that costs like $1 a kilo, but they'd sell their own really high quality rice for like, I don't know, $10 a kilo or something. So that happened quite a lot. So the priority for them was making the income. Yeah, it wasn't.
But that's not overly sustainable.
It actually kind of not worsened their food, but didn't really make a difference to their actual food security. Do you know what I mean? Like.
So when you talk about the women obviously needing to be involved, or the women trying to be involved from the point of view of understanding more about the nutrition and having to provide for themselves, are we talking then about you needing, the work you do needing to also then work on, I guess what we might call put under the umbrella of gender empowerment and stuff? In terms of getting them to be able to speak up in that, like you were saying, in that male-dominated area, and getting them to have a say in that decision-making about what was happening to the food.
Definitely, I think, I don't think we branded it as female empowerment or anything, but definitely saying to the women, you are in control of this part, and it's very important that, you feed your family and you feed the men who are going out to do the work, but have you actually considered, you could save whatever it is that you produce. It may not be rice, but it might be like, because rice in itself is not even though it's such a huge staple, it's not very high in micronutrients or anything like that. It's just for carbs, right?
Yeah.
So we're saying, okay, maybe you cheapen on the rice, but like sweet potato,
Yes.
which is extremely high in vitamin A and all that kind of stuff.
Yeah.
Very easy to cook. Kids love eating it. You're also producing sweet potato. Can you just produce that for yourself? With the money that you have with this, just have a small little garden.
I was going to say veggie garden.
Yeah. So this is your main thing, is your rice production or your fisheries production, but keep something for yourself. That could be like something that you do, which then supports your family. So I guess it's like going back to what you said about changing the mindset and changing that cultural perspective.
Yeah.
So I think. Yeah, I don't know if it answers your question anyway.
No, you did.
Yeah.
I mean, like I say, I termed it gender empowerment, but like you say, even just letting the women know they have a voice to sort of be able to contribute something, or like you say, be aware that they can save some of the better food or have a better understanding of what they need.
Yeah. And it's hard to measure, so when you're evaluating programs like that, it often doesn't get a lot of traction because you don't see an instantaneous change. It's not like you can say, the cost ratio this works like that. So it was really just about building their capacity in the knowledge of foods, and then saying that these are the practical ways that you can use the foods that are available to you in a way that actually makes a pretty big difference to your child's diet or your diet if you're pregnant or something like that. But we actually, in nutrition, because it's such a female-dominated thing, you actually want to bring men into the conversation rather than just having women go to their husbands, what we need to do, And in Cambodia, it was interesting because Cambodia is quite a matriarchal society. So women actually do have a lot of power. And my husband's like, Cambodian men ask for lunch money from their wives, and that's how, if your wife's going to give you, you get a lot of credit, with your people. So, they are able to influence some decisions, but, men often are in control of the market movement of their products, and so they mismanage funds more frequently than women do. And so the women do control and have some say. And so we tried to, when we did those community days with everyone and everyone brought in something, we'd often try to bring in the men as well if they could, and try to encourage that, father-child sort of bonding. And actually it's not just the women's job to feed the kids. You can be a part of it too,
Probably valuable for them to have an understanding of the bigger picture too, exactly how all the elements contribute to what they're doing and to their family's life.
So I took a lot of that stuff into the Lao project that we're doing now, which is actually researching the effect of nutrition programming on the effect of stunting and malnutrition in children, and that involves a lot of bringing in the men, and bringing the whole community to those days where we do the outreach stuff. It's not
so
just
that's
targeted.
an issue in Laos.
I think that's a men thing is an issue everywhere, really.
No, I mean the stunted growth of the children and stuff. Big issue.
It's also an issue in that. In fact, Laos in Southeast Asia, maybe with the exception of Myanmar, Laos experiences one of the highest, stunting and
so the
wasting
cause of
rates.
that is what? Just poor nutrition through pregnancy and stuff?
The cause is part of that, but also it's an intergenerational thing. Laos, like Cambodia and stuff, has experienced war and unsettlement. So in Laos, it's like an intergenerational thing. Okay. So stunting isn't something that you can just solve overnight by giving people more food. No. So it was, I think, and also being of really low resource poor, and then coming from that kind of environment just created this intergenerational gap of full growth potential, if you will.
So the project you're doing in Laos is based on what, food sustainability or food?
It's based on,
in terms of addressing that issue with children, like the stunted.
It's sort of trying to diversify, saying that when you diversify diets and you improving community engagement, that it has an effect on child growth, essentially. And so trying to build that into policy. So instead of having policy focused purely on very medical things like, you know, immunisation or deworming, vitamin A supplementation, calcium supplementation, we're looking at a more holistic approach. Is if you're bringing in the community, and if you're doing a lot of counselling, and you're doing demonstrations about how to properly utilise food, and parents know more about, you know, safe birth and adequate complementary feeding, that should also be built into the policies. But we need to see evidence that works, and then the policymakers are then more inclined to make those decisions, because it costs money, you know. And one of the factors is also trying to work out what is the monetary value in doing this, so that are the costs, you know, benefiting the outcomes. So trying to put a dollar value on that, saying how effective is it,
which is what governments and policymakers
which is what they
always
want.
to know.
So,
are they going to get value out of it? Ridiculous. Because I mean, a lot of these things you're talking about, you'd think a no-brainer, like they would be logical. That good nutrition leads to better health in children and women.
And stunting is a thing that also affects your GDP. You know, you're not just stunting in growth; you're stunting in intellectual capacity, or all of these things. You know, and
they're all connected.
It's all so it's kind of you would think that would be something that everybody will want to address. But I don't know, other things like more visible, like scabies, you know, people don't really think of it.
That before, no, and that's what we were saying before. You don't think, I mean, we know it's around, and we know it's one of the, you know, historically long ongoing diseases that affect a lot of global south countries. But like you say, you don't realise it's still affecting them in the way it is affecting them, like with to the level it's affecting them. Which is, and
then other things take over and priority, because they're like more glamorous to talk about.
Or, you've seen nobody. There's no glamour in scabies on your policy.
No, or stunting for that matter.
No, that's true. Does not reflect well on the government of the country. No, that's true. So I was going to ask you about the issue of food security and the way it's intersected with your work in both theory and in practice. But I'm not sure. I have a feeling you've probably already addressed that to some degree. So again, getting involved with small skilled farming. Is that where you try and aim and in, you know, roots-based community development, even when you move different projects, is that what you look to aim at? Is that where you think the core base is for you to be able to deliver a lot of these projects and the messages you're delivering with nutrition and what have you, and food security and health?
I think if you're thinking about planning a program or a project, that's probably where you'd go. But I think where the real change happens is policy and governments. You know, do you know what I mean? Like,
so you're saying you have to start at the top to work down, as opposed to starting from the base?
I think you have to do both and meet in the middle, because the top are going to want to know what's happening on the ground to give evidence there, but then you need the policies in place for things to happen down there. So like for food security, there's so many different aspects of food security that can impact on the level of security. You know, it could be like climate change policies, it could be you know, gender-based violence stuff, you know, it could be gambling or something, you know, like it's just so many different things. It could be like microfinancing or financial security, all these sort of things. It's not just about agriculture and production and stuff. So you kind of, if you're looking at doing something, you know, programmatically, you'd have to sort of address it from lots of different areas, but you need that government to support to know that what you're doing on the ground is going to matter and is going to be a sustainable outcome for that community. So I think there's been a lot of, at least in my, I don't know, it could be a bit outdated because I haven't worked internationally for a while, but I think there's a lot of focus on things on the ground that look attractive and almost clickbait for governments, you know, going, oh, that looks great, and it looks like the optics of it look great, but, you know, what you're doing on the ground may not be that
Not attractive or
impactful.
glamorous, yeah.
And so it kind of clouds what the policy is going to look like. So I think it's a really, really complicated thing that I don't think we have right yet, because for whatever reason, there's this miscommunication between the top and the bottom. And that's why I feel like, research is really important.
Well, I was going to say that's where your evidence-based data comes in, where you have to prove to the government that this is actually what the situation is.
Yeah, but governments also need to listen to the research, and often governments don't, because the donors or whoever don't want to listen to the music, all the music, because it's not attractive.
Yes, yeah.
So there's this sort of weird off balance between the two a little bit.
So what are the sort of, when you're talking about donors and that, who are the donors? Where do they come from? Are they connected mainly with the government, and that's how the money funding throws in?
Yeah.
Or do they come in philanthropically or in a different way?
I think if you had philanthropic money, it'd be very different. I feel like I'm a cynic when I talk about money these days, because I've seen how money comes with strings.
Oh, absolutely.
Especially from governments.
Yes.
I don't know if I'm allowed to say this.
Yeah.
AusAid, or not AusAid anymore, DFAT.
Yeah.
And that's no surprise.
No.
They don't make us, they don't hide it either. I'm only giving to X, Y, and Z because we have bilateral relations or whatever. I think philanthropic money is really great, and you can say what you want about Bill Gates or whatever, but although he's become more like a country of his own a little bit when it comes to donating money, right? But I think I for my Lao project, and Chris knows this too, but we receive some philanthropic money, and it's just great what you can do with that, because there's no strings attached. It's genuine. I want to help this place, and as long as you give good evidence and you give the truth, that's what you want.
So how does that vary from if you got funding, for instance, from, like I was saying today, is it IDAF? IFAD, sorry, the wrong way around. IFAD or the World Bank, anything like that, in terms of funding from them, but they're loans. But are they the sort of things the governments take? They get loans from those things to organise agricultural development projects, or can you come up with a project and go to those resources to get loans and that change it, or are there still strings attached to those sorts of loans, funding that way?
I think most donors want to say that when they fund projects, it comes from the ground up, but really it just comes from their own policies and what they want to do. So World Bank gets money from the world governments.
Yeah, that's true.
And so, that comes with its own thing. And then people like IFAD or other, they're also international. They also get money from governments, So I think governments just want to give money to whatever looks good for them at the time. And I mean, even recently we're evaluating projects in insert country name here, insert, and then we've sort of looked at data, and the data doesn't look great. Like it's like you want to see the change, but the change is small. But the cost is huge to get that change, And even though this program might sound really great in principle and, look really great in photos or whatever, without even concluding the study, some governments have jumped on it and go, I'm going to give you 100 million, not 100 million. Do you know what I mean? I'm going to give, because it looks good for us.
Yes.
And then we can go back to our constituents and say, look what we've done here. But if you just use that money on something that actually works, like imagine the difference you could make. Like in some projects that I've worked with where we've been given millions of dollars, I kind of want to go, well, what if you just, you've got, say, $10 million and you've got 100,000 beneficiaries. If you just gave everyone that money and taught them how to use it properly, how much would you change there? But nobody's doing that. No. Like, I'd love to do, and, but...
So has that, in terms of your time of working in the sector, in terms of what you do, has that changed? Has it gotten worse, or has it always been like that? Have you always found that?
I'm not really in that so
But
much
even when you were
anymore,
working
but
like
when
in Cambodia and stuff, like, you know, just the knowledge of where the funding was coming from or if there were strings attached, has it always been like that?
I feel like it might have always
Okay.
been like that. I feel like when I was young and starting off and I had my rose-tinted glasses
Well,
on.
that's the other thing, yeah.
You know, I was like, oh my gosh, I'm going to change the world.
Yeah,
and
that's true.
I'm going to do it from the inside out. I'm going to go work for the UN and I'm going to make the UN listen to me. That's not how it works, you know. And then now I'm like, oh my gosh, you know, trying to get stuff done with certain agencies is like trying to flog a dead horse sometimes.
Well, I was going to
you know.
say, it is constantly like
Want
pushing
of
a
better
boulder up a
word.
hill.
Yeah, it's just like moving at the pace of an elephant. But I think, I don't know, maybe it's always, I feel like not much has changed based on what we've experienced recently with that stuff. So I was just like, oh no, why is this happening, you know?
It's very frustrating working on all of different projects and having those factors come into play.
And I think we need more practitioners who then evolve into researchers because they understand what it means to be in real life work.
Yeah.
And there's researchers who just do research for research.
There's a lot of academic
Which is
researchers, that's
great.
all they do.
That's all they do,
That's
which
all
is
they've
great
ever
because you need that. But you need that element of real world situation. How is this actually going to work? Is this going to be a sustainable thing that you're recommending? And often, you know, if you haven't been to a remote health centre in the middle of nowhere and you say, well, we need at least, I don't know, 5 midwives to deliver a baby or something, well, it's not feasible because you don't even have one nurse of a, you know, high school diploma working in that area, you know. So you need to have, you know, a lens from both sides. And I think there's more of that happening now, I feel. But I also feel I'm a bit lone horse in that area too, you know. So.
Is it because there's not enough known about that area, like the area that you work in, that there aren't more people getting involved, like coming through and working in that area? There's not enough known about it, that it is an area of need, or not interested in it, or what?
I think it's more we speak different languages.
Okay.
And I feel like when I was practicing, I didn't really understand the world of research very much, and I didn't understand how that was going to help me with my program. So I kind of just made it up. Like, you know, I made up my own research questions, and I went and, you know, so with that child, with the mobile app, that was my first paper. It was like getting all the data from that and then doing that. I'm not sure if I did it right because I hadn't done uni stats in like 10 years at that point. You know, now I'm going, oh my gosh, what have I done? But, you know, I think we speak very different languages, and so there might be a disconnect.
Yes, I was going to say there's that gap in between, isn't there?
There's a gap, and not enough people to fill that gap, or not enough even talk about that gap.
Yeah.
And I think that's where Burnett's a great place, because you've got people who also work, you know, like actually work there, and then people who are researching it. So there is this element of trying to marry the two up.
Okay.
And it's very accepting of people like me who've come from that background who now want to work in research.
Okay.
And I can do my research as my full-time PhD, but I also work on implementing projects in actual countries. So I know that, you know, what I'm doing actually does do something to the community. So I don't lose that practitioner edge, if you will, and that really helps with my research, putting everything into perspective. Okay. What does it mean on the ground? Is it actually going to help people? Is it actually going to change practice, you know?
Which I think can get lost sight of by some researchers, in terms of they're doing research for research's sake because they're curious about the answer to the questions or the things they're researching, as opposed to it having a practical application necessarily. So
and all evidence is, well, most evidence is good evidence if you've done it right. So that it all definitely helps in the long run, but it definitely adds a lot of value if you can bring your, you know, background or history of, this is what it's like in this rural community. And if I imagine most rural communities like this, then I can really add that extra 6 cents, if you will, to your research. All
right, so I'm just curious in terms of, like you say, the amount of time and the path you've taken, and we'll use this one to sort of wrap up a bit in that. What are the changes, or are there changes? What changes have you noticed? And we can be talking about everything from the type of food production to the understanding about nutrition these days, through to the effects of climate change. From when you started, what are the main issues? Have they changed? The main issues that you look to address in your field in terms of looking at food and nutrition and through agriculture, through sustainable agriculture and food systems. Have the issues changed from when you first started, do you think, through to now in terms of what's impacting that part of the sector?
I think it depends on where you work. So I think it has changed in places like Laos and Cambodia because human capital has changed there. You know, there's just so much economic growth in those areas. And then I compare it to my work in PNG.
I was going to ask you about PNG actually, yeah. It's
like totally different. You're just still, you know, you're looking at 10 years further behind, I don't know, arbitrarily, you know. So it's hard to say. I think now that I work in more on PNG nutrition stuff with the community, I just get the sense that I'm back to when I first started, some of the same issues. But then if I go back to Cambodia and look at all the stuff there, it's definitely improved a lot, you know, in terms of access to finances or improved agriculture and food sustainability there. You know, I think that's really changed a lot. You know, my husband worked on a rural electrification project where he tried to, you know, communities, when we first were working there, didn't have electricity and now they have electricity. You imagine how much that opens up. And I think they also use, I think like social media has changed things a lot. So yeah, I think there's definitely been some improvements and but you know, depending on where you work, how quickly those improvements are made.
And of course it's down to cultural as well as geographical. If you're talking, you know, cultural in terms of PNGs, if you're then going to the rest of the Pacific, you talk about geographical as well, because just, you know, the spread of the Pacific in terms of each of the countries, they're all made up of islands. Like, you know, that are, people don't realise how far apart they all are, what areas they cover.
And culturally as well.
Absolutely,
it's like
culturally.
Miles apart, polar opposites in some ways. And that really plays a huge part, you know, because in PNG everything is very clan based and, you know, wontoks and, you know, my village, your village, you know. So it's very different, So I'm not sure, maybe my limited experience, but I'm not sure that element is recognised enough, you know, when you're talking about, you just compare them across the board without adding those layers of nuance to it. So I think in Laos it's definitely improved a lot, you know, and China's made a huge difference.
That's for sure.
To development, you know, all the stuff in Africa, all the stuff in
absolutely.
Asia. Like
their footprint is huge, and they do a huge. The projects they do are huge, and they do a lot of stuff. Absolutely.
I mean, I tell you a funny story. I went back to Laos, so I have to go back to Laos every year.
No, that's fine. Absolutely fine.
And they've got this new train system, which is like high speed train. I'm like talking like Tokyo style.
Really?
Oh, it's like ridiculous. It goes like 300 k's an hour or something.
Wow.
So Chinese built it.
Is there a need for that in Laos?
Apparently so. Well, I used to have to go by plane so Luang Prabang is a very touristy area. From Vientiane to Luang Prabang if you were to drive, would take you like 8 hours because it's across like mountains and, you know, the geography of Laos is ridiculous in terms of the mountains that you have to go through. It's so difficult, the terrain. And then you could fly there, but most people couldn't afford that, right? So you take, I don't know, an hour and a half to fly there, something like that. Now it's like, I want to say an hour and a half by train.
Wow.
High-speed train to get there. And the Chinese built that. And it's huge. And all through COVID, because nothing was happening. I mean, not nothing was happening.
Yeah, no, what you mean. Yeah,
it was like clear, you know, no tourists, no nothing.
Yeah.
And they just built this thing in like 2 yees. So I went before COVID, I went after COVID. It was like,
and it's obviously being
what
used.
What the heck? Yeah. Heaps, you know, mostly by tourists, not so much.
Well, I was going to say, could locals afford it?
Yeah, but locals do now go to Luang Prabang a lot more from Vientiane, you know, for domestic tourism. But they just blasted through all this hill.
I was going to say that's the other side of it, isn't it, in terms of how they got it through the terrain.
Literally just went through mountains. So you get this beautiful scenery and then you go around the side and the mountain's scarred.
Yeah.
And then they didn't inform the farmers. So some of that train track goes in through farmland. So it'd be like you have this plot of land, they just went right through it without really a lot of consultation.
No.
And so the farmers would take their livestock across the high-speed train, which I've got to mention there's also a high-speed highway going across for cars.
Oh.
So alongside this high-speed
So
train.
the farmers now have to get over that?
So the farmers, to get to their other side of the land, would go with their cows and whatnot past the train tracks, past this high-speed freeway where people are travelling like ridiculous speeds because there's no speed cameras. And they were getting killed. And the cows, they'd get run into.
Yeah.
So there's new signs saying,
That whole
watch out.
opens up a whole new avenue of
it's
questions,
like a
doesn't
whole
it, about
thing.
farmers and small farm holders
But
and
you
stuff
know,
like that.
So that's the cost of
Yeah.
development almost, because these
Yeah.
smallholder farmers with their land, and then their land's being sort of literally run over
Yes.
with the government, you know.
Yeah.
And we were travelling down, you know, along these roads and trains, and my colleagues were saying, oh yeah, they had to put signs up about crossing the road here because, you know, people they'd never been exposed to high speed trains or freeways before, and they didn't know that cars could travel that fast. And they'd take it across with their yaks and their, you know, they tax are like little motorized wooden carts in a way, and it goes so slowly across the road, and then like a high speed car just bam, you know. And they said they had so many incidents when they first opened up where like livestock were lost, and you know, massive incidents on the freeway. I mean, you don't hear about this in the news.
No.
So, you know, it's just okay, great.
But that's the other side of the coin, isn't it? Like you say, you talk about development, but that's the other side of the coin.
Yeah.
No consultation, usage of land, the consequences of that in terms of rural communities and you know, government pushing through development.
You know.
Yeah.
So it's great, but also you really need to get the community on board if you're going to make this such big change. And often in countries like that, you don't get that consultation. I mean, here you'd be like, wouldn't even be allowed to build a train over it, you know. There'd be huge revolt, but, you know, in some places it just, we want to do it, we're just going to do it.
But that's another theme in the development
anyway,
sector,
sorry about that.
No, it's all
please
good.
don't show this to the local government.
No. But it's all good, isn't it, in terms of, I was going to say, just those discussion points in that that's what we talk about a lot, is that you have to bring local community into the decision-making process because it's them that's being impacted. It doesn't matter what we're talking about, whether we're talking about health or food or whatever we're talking about. They're the ones being impacted by any of the changes happening, so they have to be in on the decision process.
Yeah.
So, you know, that's still that's another boulder you're pushing
uphill. That's another thing,
That's for sure.
Yeah.
All right, thank you very much, Sian, for joining us tonight. Thank you for the conversation. Now, we have a gift for you.
Oh, really?
Don't mind the box, I didn't wrap it. Now, it's sealed,
clever wrapping.
I've got another way. Instead of opening the box for you, this is what's inside the box.
Oh, cool. I love mugs.
Only guests get this. Only guest speakers, so you're one of a rarefied few that actually have a Women in Aid and Development mug.
That's awesome. That's like my school giving out spoons.
See? Rare.
Yeah,
the only
school
people at the
gives
Burnham
spoons,
Studio
so
has one of those.
I'll just be like taking that to the office.
Nobody else has it. Make sure nobody takes it. Nobody else has that. So.
Oh, thank you.
That's all right. Thank you. Thank you for coming. We appreciate your time and your
Thanks
contribution
everyone
to the discussion.
for coming.
Yes. Did anyone have any questions for Sian?
There in the green.
Anyone have any questions?
Your PhD.
Yeah.
So that's